Well, who likes going to the doctor? Not me, and not Tony, and that's even with me as the doctor. You know, a great number of these pets are stressed. In fact, one recent study showed that 78.5% of dogs and cats in the veterinary clinic, they're not all fearful, urinating, reactive, aggressive, but many of them are showing indicators of stress. 78.5% do. That means that only, 21.5% are fully relaxed. And so, yeah, we need to take care of that. In part because we can't make as accurate a diagnosis when they're nervous wrecks. And we have some great ways, I have cat hair on my nose, of helping cats and dogs feel better. So, by the way, let me know if you've had your pet an experience that's been so stressful and unsettling for you and your dog or cat that you're reluctant to go back. That's not in the best interest of your pet's health.
Here's Cindy.
But hello Cindy. Oh, wonderful. Thank you for coming. I'm delighted. Whoops, Tony T, stay put there, little guy. We're not done with you. We want you to sit here. So we're going to talk about what to look for and what can be done about it. Actually, just a few of the things that can be done about it, because there's a great deal that we can do to help these pets feel better. So, by the way, in case we haven't met, I'm veterinarian Dr. Jeff Nickel. I'm residency trained in veterinary behavior medicine with a whole lot of years in general practice, meaning that there's hardly anything I haven't seen. So if you have any questions on your pets, it doesn't have to be behavioral, and it doesn't have to be related to stress in the veterinary clinic. It can be anything you want. Just put it in the comment line. But I'd like to hear specifically about experiences in the veterinary clinic that frankly didn't go well. You can go ahead and tell me things that maybe were mistakes on the part of the staff, and I'll tell you what you can do to help bring out the best in them and your pet and everybody else. Because the truth is everybody wants to help, and you can be the knowledgeable one, okay? Ideally your veterinarian would be, but you can be. You know, if you can hear me loud and clear like Cindy can, please put some hearts out there just to let me know that, you know, I'm not just talking to Carolyn and Tony here. Gaston, the fuzzy white cat, may show up in a few minutes. And we still don't have a dog, but we're working on it, and I'll tell you a little bit more about that later. Thank you for the hearts. So I want to tell you a brief story. This happened with a couple of folks, young couple, had two dogs, a couple of boxer crosses, two females, and the big problem that they came into my office for was that these girls were fighting, and fighting rather badly. These aren't necessarily fun cases to treat, by the way. They are the most common problems seen by veterinary behaviorists, and a lot of research on that one, and a lot of experience too. Well, we were able to make a difference for these two, and they're doing much better. But one thing that these folks asked me, they said, while we're here, and you're taking these pets into the treatment room for a physical exam and for a lab draw, make sure they're healthy, because we're always looking for what else is going on in the body before we tackle the behavior issues, because so often problems with the skin, the joints, the mouth, the ears, internally, like the liver and kidneys, all of those things can impact behavior. So we're looking for all of that. And they said, well, while you're in the treatment room examining these two girls, can you trim their nails? And I said, well, of course we can. And they warned me. They said, you know, we've been to groomers, we've been to veterinarians for these nail trims, and it's a really horrible experience, because they end up at 3 or 4 people lying on the pets, and the pets are crying and panicked, but they get those nails trimmed. And so, can you do that? And I go, I can do that, but I'm not going to do it that way. So I took the pets into the treatment room one at a time and examined them, took their blood, and we trimmed each of their nails with no problem. Well, what's the magic? There's no magic. It's a matter of understanding how to avoid triggering their fear. And in fact, all I did was have one of our very quiet nurses squat. Everybody needs to be near the floor. Nobody restrains. That's the R word. We don't, boy, if we restrain at all, it's minimal. And in this case, really none. This young lady, very, very quiet and gentle and knows exactly what to do. very gently held the dog by the shoulders, squatting next to her. So if you look at Tony here, we're all facing the same direction, and she's holding the shoulders with her hands around the dog's shoulders and neck, just so the dog knows that, it's not really going anywhere. Although, these were 65, 70-pound dogs, and they could overpower any of us. They're pound for pound a lot stronger than we are. So she just held their shoulders gently, and I very, very slowly squatted on the other side of the dog, all of us facing the same direction, by the way. When it's face to face, eyeball to eyeball, that triggers fear. The dog perceives that many times as a threat. You think, hey, we mean no harm. You don't with your pet, neither does anybody else. Well, the truth is that that's what we intend, but it doesn't have to have anything to do with how the dog interprets it. So we don't lean over and we don't approach. We lead the dog and then squat down next to it, again facing the same direction, shoulder to shoulder. And so then I had one of our folks holding the dog's shoulders, and I have got cat hair on my face, Carolyn. Mm-hmm. I can't tell you. Well, I just brushed him out before we did this, and
I can see it flying.
Yeah, right. It's all over the place. So, so very slowly, I touched each dog on the neck and shoulders, and didn't take my hand off, and moved my hand very slowly down to the dog's leg, and held the foot up very slowly, and took the nail trimmers very slowly. You're starting to see a pattern here, aren't you? Slow and sharp nail trimmers, brand new if possible. They tend to get dull easily because, they're cheap steel. And oftentimes when people use them to trim nails, there's dirt on the nails, and that, of course, dulls the blade. And you don't want the dog's nail to be crushed by the nail trimmer, which is what happens when they're dull. You want to slice the point off the nail. Do not cut any further back. The point is where they break, if they're going to break their nails. And you cut any further back, and you risk cutting into the quick, and that's painful. And, boy, they have a lifelong fear of nail trims if you do it just once. So very slowly I pick up each foot, only a little, off the floor, and brought the nail trimmer, touched it gently, and kept it there. You don't hit it back and forth. Keep it there. And very slowly open the blade and nip the point, and then set the foot down, touch the dog, keep the hand on the dog's leg, pick up the foot once more, nip the next nail, put it down, next nail. Takes a minute or two, do all 4 feet. Took the dog back, brought the other one back, did the same thing. So the folks were sitting in the exam room waiting, and they'd had experience in veterinary clinics and boarding kennels, grooming establishments, where they could hear the dog crying. And I brought the dogs back, and they go, well, we didn't hear anything. It must be a big building. You went a long way away. And I go, no, there was no crying. And the young man, I'd established a good relationship with these folks. But that young man looked at me and he goes, I don't believe you. Well, most of us don't really like being, called a liar. But I get it. He'd had these bad experiences. He had no way, he didn't have any point of reference for anything else. I said, let me show you. Well, as the way the Veterinary Emergency and Specialty Center is laid out where I practice, down the hall from my exam room is an open area. So I said, here's what I'm going to do. I'm going to lead one of your dogs down the hall into that open area because big areas feel less confined. And I'm not even going to use an assistant this time. I'm going to put the leash under my shoe, so that way if your dog tries to take off, it isn't going to go anywhere. And I'll show you how I very slowly pick up each foot, but I'm not going to have you folks right there because more people tends to feel make these pets feel kind of confined, even though they're pet parents. These dogs love their people and trust them completely, but you get more people standing and kind of hovering around, and boy, that drives up the nervousness. So again, when I have pets in the treatment room, I tell the rest of the staff, please don't come near. Please, if you're going to watch, do it from way across the room. It just makes them nervous. So I said, I'm going to lead this dog down the hall, and I want you to stay in the exam room, wait about 10, 15 seconds, and then peek around the corner, and I'm going to have your dog facing the other way, and she won't see you. And I'm going to be facing the other way. I won't see you either. So I squatted down next to the dog with the leash under my shoe. And, once again, shoulder to shoulder with the dog, we're facing the same direction. And I pet the dog very gently, run my hand down the neck, down the shoulder, down the leg, and very slowly picked up a paw and brought the nail trimmer to it. And of course, I'd already nipped the points off the nails, so I just, showed them from a distance. And it made believers of them. Now, it doesn't work that easily in every case, but the point is, and this is what's called fear-free pet handling, not pet restraint. And there is fear. I mean, let's face it, as I mentioned a minute ago, who likes going to the doctor? Well, none of us does. So we've got to take into account let me see. Oh, there we go, we're back now. Swipe left. Oh, there we go. Oh, Julia, you're here. You may have mentioned this, but I dropped in late. Do you think some dogs are insecure about nail trims? Oh boy, Julia, they sure are, due to the trauma of having dew claws removed. That's probably not a factor. If the surgeon knows how to do it, and most veterinarians are pretty good because it's frankly a simple procedure, and of course when dew claws are removed there, the dog is under anesthesia. Now in 1 to 2 day old puppies, they're sometimes done without anesthesia. I don't think that's a factor. Dogs tend to be pretty fussy about their feet. Cats do. And that's why you go super, super slow. And the ambient or nearby arousal triggers, noise, people, activity, all that stuff is eliminated if possible in a bigger room and super slow. People like to, especially staff in the veterinary clinic, feel like if they talk to the pets in these high squeaky voices, that they're going to feel better. They don't. Don't say anything at all. Less noise is better. So yeah, slow and steady wins this race, Julia. So anyway, who's here? Who else is here? I didn't notice. Tony T, you're here. All right. Well, the darn thing isn't cooperating. Try it again. Swipe left. Oh, there we go. So Portia is here. Wonderful. I'm glad you're here. Judy. Wonderful. Cindy, too. And Bernadette. I think we've met before, Bernadette. And Darren. Excellent. And Lisa. Thank you all for coming. So here's what I want to share with you. A couple of things. Here is a couple of research papers and a very good position statement. Let me share this one with you. This is called, I'll show it to you, but I'm not going to get up and dump Tony off my lap, so you'll have to look at this in reverse. This is from the Journal of Veterinary Behavior. My other paper here is, also from the Journal of Veterinary Behavior. We get research published a lot of different places. And the name of this paper was Assessing Stress in Dogs During a Visit to the Veterinary Clinic. Okay? And they used standardized behavior tests. So they had reliable, validated results. And so I'm just going to read you a couple sentences from the abstract. A visit to a veterinary clinic can be very stressful for a dog, and stress may interact with pain. So if the pet's already painful, and sometimes the pet parent is not aware, especially with cats, they don't show it. Cats, don't forget, they are a predator species. That's what they're genetically programmed to do, is chase down and catch mice. But they're also a prey species, meaning that they're small, and in the wild, they can be some coyote's lunch. So they're looking around, looking over their shoulder in an unusual situation. There may be a threat. Well, many dogs are that way too. And you think, well, okay, small dogs. Many big dogs are very fearful, and that can be a bigger problem, needless to say. So if they're painful and you don't recognize the indicators of pain, then that certainly can add to the stress and make them more prone to be reactive. But even if your dog or cat doesn't react aggressively to the veterinary staff, and some do, you don't want the pet to have a miserable experience, because each time you try to put them in the carrier after that, or take them in the car, or you pull into the parking lot in the veterinary clinic, many of them just start to wig out. And when they're just nervous and reactive, it can make it really hard for us to find the problem on a physical exam. And not only that, we love our pets, and who wants our pets to be a nervous wreck, getting worse each time? So one of the takeaways from this study was that dogs rated as more stressed were significantly less likely to engage in social contact with an unfamiliar person. That's the member of the staff. So if you've got one of those, 18.5% of dogs and cats who, hey, they're happy at the veterinary clinic, and those do exist, Okay, you don't have that much to worry about. But if they are less prone to engage, just with being talked to and being touched, or taking a treat from the staff, and you say, well, other people this dog meets, other strangers that dog meets, doesn't have a problem, but boy, it does here. That tells us something important. And again, I'm going to give you a couple of real simple things we can do to make that a lot better. Okay? They were significantly more willing to play and eat a treat outside the veterinary clinic compared with inside. And I was just actually consulting a doctor, a general practitioner I've known for many years. In fact, I hired her out of veterinary school back in the early 80s to work in my general practice. And she's working in another hospital now. Of course, I've specialized. She sent me a case, and this was a dog who was frankly quite aggressive when it came in to see me. And it had been that way at her hospital as well. And one of the things that I advised her on was, examine this pet outside. Because the dog has a much greater sense of freedom and openness when it's outdoors. Don't even let the dog come in the hospital unless, you got to do a procedure. And what I suggested that she do is squat down with her back to the dog, at least 20 or 30 feet away from the dog, and have the dog led up next to her. She's already squatting. The dog parent comes along next to it and squats down on the other side of the dog's shoulders. And once again, everybody's facing the same direction. Everybody is small by the dog's perception and thus less of a threat. So we want to diminish every possible stress trigger. And so this study found they were more willing to take treats outside. Well, there's a reason for that. And this implies that the dogs themselves experienced inside the clinic as being more negative. Well, if that's the case, let's work with it, okay? Here's another. I'm going to hand Tony to you, Carolyn, and maybe you'd hand him back to me in just a minute because he's getting a little fussy. And I like having him with me, but I'll take him back in just a minute. All right, here's another one. This is the second one I'll show you. Also from the Journal of Veterinary Behavior, and this is called In-Hospital Administration of Dexmeditomidine Oral Mucosal Gel. Okay? Well, what is that? I'll explain that in just a minute. But I'm going to read you a few passages from this as well. Really very significant research. The objective of this study was to assess the efficacy of, it's called dexmedetomidine. I'll show you this in just a minute on the other side of the camera. It's called Cilio. I've shown this before if you've been to these Facebook Lives. It's an oral mucosal gel, okay? It isn't really given orally because if it's swallowed, the digestive enzymes break it down and it doesn't do anything, okay? But if it's deposited between the lower lip and the gum, it's very easy to do, a little glob of gel. Lift the dog's chin, close its mouth. 20 minutes later, this stuff reliably reduces anxiety significantly. Now, Cilio, here, I'll show it to you right now. This stuff is approved for only one purpose, and that's for dogs with noise phobia, like thunderstorms and fireworks. And here in Albuquerque, hot air balloons in October, and that's coming up soon. Okay, Sileo. If your veterinarian doesn't have it, they can order it. You don't have to be a behavior specialist in order to dispense this stuff. Any veterinarian can do it. Okay, so there we go. And so this stuff, we use it off-label, which means, for something other than what it was approved for. And that's perfectly acceptable as long as we tell people. Okay, so your veterinarian can dispense it, or they can take it off the shelf when you are, when you and your dog are there. And by the way, you can give it to cats, even though it's only approved for use in dogs. So it comes in this syringe, and show you what it looks like. There we go, like this. Okay, and it's got this little wheel on the plunger that you adjust for the dose, and it's very easy to dose. And I usually have people put peanut butter on it, let the dog approach it, so you're not approaching the dog and scaring the daylights out of her. And then you deposit it between the lower lip and the gum, and close the dog's mouth, wait 20 minutes, and they're much, much better. Okay. Well, this study had to do with that. They used the generic name, Dexmeditomidine. Say that 3 times fast. And they were, dogs rated as more stressed were significantly less likely to engage. Wait a minute. Oh, the other page. Here it is. I wondered why it sounded like I'd done it. Okay, the objective of this study was to assess the efficacy of dexmedetomidine, oral mucosal gel, in alleviating acute stress during standardized veterinary visits for physical examinations when administered by the owners in the hospital. So you give this to your dog yourself. Again, it's very easy to do. Results showed that the Cilio gel significantly decreased the likelihood of dogs exhibiting the behavior categories of stress, fear vocalization, like whining and yelping and grumbling, okay? Clear indicators of stress. Avoidance behaviors, like oriented toward the door, attempting to leave the room, trying to jump from the table. You know, that's real clear signs of stress. And, you know, we're struggling with a pet trying to examine it. Well, that's unnecessary. And the Cilio is so effective and safe, okay? And other stress-related activities like trembling, panting, and sometimes urinating and defecating in the exam room. These pets are a wreck, okay? By decreasing stress in dogs during physical examinations, we can diagnose more accurately and improve welfare for dogs and cats. Well, accurate diagnosis, for crying out loud, if we don't get that answer right, we're not really helping the pet. And a good physical exam on a relaxed pet, that's good medicine. And also, you know, we like that too. So, and last, I'm going to put this in my notes following this Facebook Live. It's a link to the American Veterinary Society of Animal Behavior. And of course, I'm a member of this group. And there are multiple position statements you'll see on a lot of useful topics. And they're written for pet parents. They're not in research jargon, so you're not going to get snowed. But a couple of valuable points in here. And I think you're going to find this really useful. So I suggest you click on this link. I'll put it in. You'll get it about an hour after we're done here. Nearly 40% of all cat owners report they get stressed thinking about a veterinary appointment because of their cat's stress at the veterinary clinic. Well, that matters too, doesn't it? I think the pet parent, our feelings count, don't they? More than a third of dog owners and over a half of cat caregivers say their animals hate going to the veterinary clinic. And they are less likely to visit the veterinarian. Well, how can we give them good preventive care? You know, vaccinations, annual stool exams to make sure they don't have parasites, check their teeth, check their eyes, palpate for tumors. This is important stuff to catch problems early, and people aren't coming in the way they could because they're worried about the stress of their pets and their own stress. I get it. Not necessary. Okay. I mean, we've got research that shows that people are stressed when their pets are. The signs of anxiety often begin at home. Cats may hide or struggle when a carrier appears, resulting in bites and scratches. During travel, they may vocalize, vomit, defecate, and even become dyspneic, which means difficulty breathing. Dogs may yawn, pant, or vocalize during car rides. I mean, this is not healthy stuff. And, you know, we're talking about giving the Cilio at the veterinary clinic. You can give it at home and then bring the pet in. And by the way, as much as it is not approved in cats, there's plenty of outside research to show how safe it is. And while the dots on the plunger of the syringe are used to measure the dose, with cats you use 1 dot between the lower lip and the gum. And if your veterinarian is unclear on this, they're welcome to contact me. Everybody in Albuquerque and Santa Fe knows me. Even if you're calling, you know, from some other part of the country or the world, your veterinarian is welcome to contact me through my website, which is drjeffnicol.com, drjeffnicol.com. And by the way, I really love it when people come to my Facebook Lives, but if you can't make it and you want to see these every week, you can go to my website, drjeffnicol.com, and at the bottom of the homepage, you can sign up and subscribe. And every Tuesday morning in your email box, you will get my weekly media blog, which is my newspaper column, and you'll get my Facebook Live from the week before. And by the way, when you do sign up, and it's no charge to subscribe, I will send you, also at no cost, my pet first aid and CPR guide, which is worth printing out and keeping handy. So here are the things I want you to start looking for when you have your dog, and we'll talk about cats in a minute, and your dog in the veterinary clinic. Lip licking. Now, we all probably do it a little bit, but they do it pretty often, and that is a very common sign of stress. Yawning is commonly seen. Hypervigilance, you know, this scanning where they're looking back and forth. That's something that people sometimes miss. Pacing, you know, behaviors like that they don't do at home. They're nervous, okay? And of course, when they get really stressed, they may raise their lip, and sometimes they'll snap and lunge. And, well, that's pretty obvious to everybody. Don't let anybody convince you that it's your fault. It is not. Now, you can go to a website called fearfreepets.com, and I'll put that in my Facebook post a little later today. fearfreepets.com. And Fear Free is an organization that trains veterinarians and their staffs and groomers and dog trainers and pet parents. They've got a module for everybody, and they've got higher levels for veterinarians and their staffs to get trained up on these things. And it's about much more than medications that reduce stress. It's about handling techniques. Stuff like, for example, when a cat comes in a carrier, don't carry the carrier by its handle, because the carrier swings and the cat gets kind of seasick. Instead, we cover the cat carrier. In fact, you should do that at home before you put your cat in the car. Put the cat in the carrier, use some food, be very gentle. If your cat's scared, plan several days ahead by starting to feed the cat in there. And then cover the carrier with a sheet or a towel, pick it up from underneath it and carry it against your chest very carefully into the car. And then when you get to the veterinary clinic, ask them to carry it from underneath, or you carry it in yourself, and the cat will be a lot less scared. Now, there's one other medication called gabapentin, and you're going to have to take my word for it because you're looking at it backwards. G-A-B-A, gabapentin, and your veterinarian almost certainly has it on the shelf. This has got many uses. It is probably the safest medication anywhere. It's a prescription medication, but frankly, it wouldn't need to be, in my opinion. It's so safe. And in cats, you can use a 100 milligram strength capsule, and they like the taste. And about an hour before coming to the veterinary clinic, you open the capsule, and it just pulls apart, and it has a white powder inside, and you dump it on some moistened dry food or on some canned food. And if your cat has had its meal withheld for a little while, so it's food motivated, it will go ahead and eat the gabapentin. You might have to mix it with Tony here. I mix it with the food a little bit. He doesn't eat it if I just put it on top. Gaston, the other guy, is right next to me, but you can't see him. He'll just go ahead and eat it. But you know, I'm these cats' doctor for most things, for crying out loud, and I don't want them scared. I want them to, you know, accept it. You know, I know people, for example, who, before they get on an airplane, they take a Xanax. Or before they go to a veterinary, a physician's appointment at the doctor's office, they'll take another benzodiazepine. You know, drugs like Xanax or Valium. There's a very safe one that physicians are much more willing to dispense or prescribe, called lorazepam, and we use it in cats, very safe. And many people take those kinds of things before they go to a stressful event. I totally agree with that. Life is short. You're not going to get addicted taking it a couple times a year or once a year, you know? So these are things that are worthwhile. And of course, for dogs who are really aggressive, freaked out, we have a relative of the Cilio, and it's called Dormoscidan. This is the Cilio, but it comes in a syringe a lot like that, and it looks very much like this. It's actually meant for horses, not approved for use in dogs and cats. We have good research on its use in dogs, and the dose has been worked out according to their body surface area, not their weight really, and it can be given between the lower lip and the gum. And dogs who would otherwise be so freaked out that they're aggressive, trying to bite and lunge, that can be given. They're kept in a quiet room for close to an hour, and then we can handle them, work with them. And then if we want to, we can reverse that with an injectable, and they wake right up. So we have safe ways of working with these. But I want you to go to the fearfreepets.com website so that you can... Do you have my handkerchief, or did I put it back in my pocket?
It's under one of the papers.
Oh, okay. I'm going to wipe the fuzzy...
No, it's under the other one.
Oh, there it is. Wipe the cat fuzz off my face. Kind of drives me a little nuts. Anyway, fearfreepets.com. So, all right, got another question here. All right, let me see if I can... All right. There we go. Okay. Let's see. Julia, do you think some dog... Okay, let's see. Portia, Cindy. Our veterinarian has prescribed this for Ivy for veterinary visits, and she no longer needs it. Now, that's the best news we could hear from anybody, Julia, because... And see, what's happened is that the dog has now been desensitized. And very often you'll hear veterinarians say, well, bring your pet in, every now and then, and drop by, and we'll have the staff give them treats, and you can walk them on the scale. And with enough repetition, they learn that, hey, this place isn't so scary. That is completely legitimate advice. The problem with it is that the level of arousal that the pet would need to have with those repeated low-key visits, very, very low. Many, 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 many times. And what you've done with Ivy, that big girl of yours, is you have used the Cilio, and now this dog has very little reason to be reactive and aroused and frantic and afraid. And you've done that a few times, and now the dog goes, hey, I have nothing but good memories of that place. What you did was you put desensitization on warp speed by making it super easy for your dog. That's the way to do it. And so, yeah, people sometimes say, well, I don't want to use tranquilizers. Well, you're not giving it every day, for goodness sake. Oh, and Isabella, you're here. Thank you for coming. I'm just delighted. That's what, Dormoscidan, that's what she was prescribed. And I have counseled a lot of veterinarians in New Mexico and other places about this. And darn it, I'll keep preaching the gospel of low stress. I'll do that, though I draw my last breath, because I love pets and I don't like seeing them upset. And I tell you what, I'm sure everybody who attends these things feels the same. Now, next week, by the way, I won't be doing a Facebook Live because I won't be here. I'm going to go to sunny Las Vegas, Nevada for the Western Veterinary Conference, and I'm going to be attending some continuing education. But the big reason I'm going is that I'm presenting. Because I'm a specialist and I'm invited to do these things. I'll be presenting on separation anxiety and a wonderful new device that can be used instead of or in addition to some of the medications that can be so helpful to those freaked out dogs. And it's called the Calmer Canine by Assisi Animal Health. And if you're interested, you can go to their website, which is CALMER, Calmer, and then the letter K and the number 9.com, calmercanine.com. And it's real easy to use. Twice a day treatments, turns itself off after 15 minutes. Your dog can walk around, sit next to you. There's no sensation at all with this thing. And 4 to 6 weeks, and it can make a very big difference. And so I really encourage you to consider that if your dog has separation anxiety. And frankly, we use that off-label sometimes for other anxiety-related problems in dogs. And in fact, it's been used in cats with good success. So, and the best part of it, I think, is that it's zero risk, because if you don't like it in the first 4 weeks, you can return it and get a refund, which I don't know of any other medical device that comes with a guarantee. So I'm a big believer in that. So anyway, I'm going to be presenting to general practicing veterinarians at the Western Veterinary Conference on separation anxiety. And while I'm there, there's a border collie breeder nearby. In case you haven't noticed, Carolyn and I and our family, we have a big thing for border collies. And it turns out there aren't very many breeders anymore, not around here. There are some, and we're just casting a wide net, and we're going to evaluate a lot of adult dogs and puppies. So next time we have a Facebook Live, I'm not going to bring one home. We're not quite ready, but we're going to keep looking. So I'm looking forward to that. And at the end of the month, we're going to start doing our Facebook Lives at the Animal Humane Association, and we're going to talk with those folks and have a whole variety of different pets with different behavior issues, and we're going to give recommendations and share some of their stories. And let's see, okay, here we go. Isabella, okay, any thoughts on CBD in this context? Enjoy Las Vegas. We sure we're sure the audience will be honored and privileged to listen to you. Aren't you nice? Yeah, CBD. It's kind of all the rage now. People are using it for a lot of stuff. And there's some pretty good research in humans on its treatment in some people for anxiety, in some people for insomnia, in some people who have seizure disorders. And not a lot of robust research in humans yet. And essentially nothing that we can really hang our hat on in dogs yet. And so far nothing in cats to speak of. Yet a lot of people are using it. So I'm an ethical practitioner, which means that we practice evidence-based medicine. That means a couple of things, really. That a diagnosis is based on research, and treatments are only, we've got to have peer-reviewed, robust, published research to justify every treatment. Not just medications, but management changes, behavior modifications. We don't come up with anything on our own. I've done research and published it, but that just adds to the body of knowledge. And so when we have medications, like the Cilio and some of these other behavior modifications, these handling techniques that we've talked about, all of that is supported by research. Well, we don't have that for CBD, and so you won't hear me recommend it. But I will acknowledge that for dogs with mild to moderate fears and anxieties, I've heard some positive reports. I have not been aware of any adverse reactions. I have not been aware of any drug interactions with other medications. Doesn't mean it can't happen, but so far I haven't seen any. So it's hard for me to tell people, thou shalt not give CBD oil, okay? But I don't give it to my own pets, and I don't recommend it because there's too many questions, and we don't have an approved product. You have to get it from it's sort of like a supplement. Nothing wrong with supplements necessarily, except that they're not, they don't have stringent FDA requirements that they have to adhere to be licensed for distribution. So there are going to be different absorptions, different purities, what's the right dose. We don't have that research. We don't have that information. So I'm not recommending it, but so far I haven't seen any real problems with it. So follow your own judgment on that one. So thank you for everybody for coming. And I just, as always, want to encourage everybody to bring out the best in your pets. You want to take the time to build a foundation of trust and choice and freedom before asking them to do things differently for us. Because dogs and cats, just like people, they can become obstinate if we only want our needs met. But at the same time, they can learn anytime during our relationship that they can trust us not to intimidate them. So enjoy your pets, and I'll see you folks in a few weeks. Thank you so much, and